Okay, so in the last lecture, I talked about what I think is a not good argument for allowing physician assisted suicide, for saying that it is morally and legally okay. In this lecture, I want to talk about a better argument. And the sort of not great argument for allowing physician assisted suicide that I talked about last lecture is one that the philosopher's brief brings up. It kind of floats a little bit. Um, I think the one that I'll talk about this lecture is more their main line of argument. And it is, I think, a much better line of argument. Um, we can't just say that there's no difference between killing and letting die when it comes to patients or generally. We can't just say, that because it's blurry when it comes to right to die cases, it doesn't matter. So I think that argument we should just let go. A better argument really leans into these autonomy considerations, these considerations of respecting people's own choices. This is what the philosopher's brief does, I think, when it gives its best argument, and that's the argument I want to focus on in this lecture. Okay, so let's talk about this autonomy interest. And as I said when we talked about rights toward the beginning of the semester, not every choice is equally important, right? Some choices matter more than others. And the ones where we really want to talk about fundamental rights are ones where those choices are about what is and is not a good life for us, how we want to live our lives, what values are important to us. And as the philosopher's brief notes, the decision about when and how to die has got to be counted as one of those decisions that is really fundamental and important, that reflects our basic values. Might be the most important decision. Some people would say that might not be, that might be inflation, but it is certainly one of the most important decisions. So if we really want to respect people's autonomy, we have to respect their choice to die. And that means not just, removing treatment when they choose not to have further treatment. That means also, the philosopher's brief will argue, positively helping them to die if that's what they want. They'll say failing to honor the wishes of the patients fails to respect their autonomy in a way that refusing some other requests, say for weird treatments, doesn't, right? If you don't let people have a choice over life and death, you are not respecting their ability to choose and decide what is good for them, what values they want to live by. And people, they'll say, and I think there's some good reasons to believe this, that there's really no conflict here between respect for autonomy and respect for well-being, right? One reason we might hesitate to grant a patient's wishes, or the doctor should, or nurses should as well, we think that what they're choosing is not in their best interests. It's not going to be good for them. But if you think about physician-assisted suicide, they'll say, the people who wrote the philosopher's brief, that there's no conflict like that here. If a terminally ill patient says that life is no longer worth living, that she thinks the pain is too much, or that her abilities have been so greatly reduced, or that it's just embarrassing to her, if she says that, she is almost certainly the best judge, they will say, about whether it's worth it for her or not. In this case, she is a better judge of what is in her best interest, what is her well-being, than are the medical professionals. If they say, well, we think you should enjoy, you could have a few more months. We think that would be good for you. You could enjoy that. And she says, I don't think it would be good. I wouldn't enjoy it. She's a better judge than any medical professional. Proponents of physician-assisted suicide will say, and I think they have pretty firm grounds to stand on here. They'll even say, not only should respect for autonomy mean that you allow these people to have help in dying, respect for well-being should also push you toward that, right? If she says the state, of pain or degradation or debilitation is a bad one for me that I want to avoid, she's the best judge of that. Helping her to avoid that is a concern for her well-being, right? Really just obvious when we're talking about the desire to avoid intolerable pain that the writers of the Philosopher's Brief talk about. So that's the basic case. Respect for autonomy says that we as a society have to allow medical professionals to help people who want help in dying, who are terminally ill. Not only that, but a concern for patients' well-being means that we, at least in cases of terminal illness, should allow medical professionals to help, and we should allow patients this decision. So let's talk about, the basic argument is a fairly simple one. But let's talk about a few objections to it, right? The first objection is that killing is wrong even if a person wants to die. If someone chooses to die, we don't necessarily think that he should have help in doing so. Imagine that a healthy 60-year-old says, well, I don't much like the idea of getting old. I think I've, kind of done everything I want to do. So I think I want to kill myself. Someone should help me, right? Well, that would be weird, right? I doubt we would think that they should get help in dying. Not in that case, right? Or just consider some other cases, right? We as a society don't think that people ought to be able to do things that risk their life just because it's their choice, right? Think about dueling, right? If you guys have seen the Hamilton musical, you know what dueling is. Two people shoot at each other because one insults the other, or vice versa, right? Dueling is illegal, but in the case of dueling, both people agree, I'm going to risk my life for my honor. We as a society say, no, even if you idiots choose to do that, we're not going to let you, right? We as a society value life, and we're going to prevent people from throwing their lives away, even if that's what they choose. Same way, even if a perfectly healthy person, if you were somebody who just wanted to kill somebody and a perfectly healthy person said to you, oh, actually, I just want to be murdered. If you murdered that person, even if you documented they wanted to die, we would still charge you with murder. You would still go to jail, and that would be appropriate, right? There was a weird case like this in Germany. They still sent the guy to jail, right? And we think that's appropriate. So the mere fact that someone chooses to die does not make killing them okay, and it doesn't mean that we should allow them to die or be killed as a society. If that is so, why should we allow physician-assisted suicide? Well, there's a huge difference between physician-assisted suicide for the terminally ill in those cases, right? Think back to Marquis. He says, what makes killing wrong? And his answer is, it deprives the person who is killed of a future like ours, one that's valuable. And I think there might be, if we think about this, and we'll see in a minute, there might be some reasons to doubt whether Marquis' explanation gets at everything that's wrong with killing, but it is an important part of it, right? And if that's so, when we look at people who are terminally ill, the thing is they don't have a future like ours, right? They're not going to, we have a number of years ahead of us. They're terminally ill. Their days are much more limited, and the days they have are not going to have the same quality of life. All that says that there's less reason to think that killing them is wrong in the same way that killing someone who has a full life ahead of them, even if for some reason they want to die, would be wrong, right? The fact the person is terminally ill and their future is shortened, and that it is a future full of pain and all the other horrible things that come with a terminal illness, that makes a difference. Killing them is not the same as killing a healthy person. Now, it's interesting. Our political divisions would say, if you're against abortion, you should also be against physician-assisted suicide, because people who are against physician-assisted suicide tend to also be against abortion and vice versa. But Marquis would, I think, say, his argument suggests that abortion is wrong, but also that physician-assisted suicide is okay, right? Even if we don't want to go that, as far as Marquis does with saying that abortion is wrong, I think that this talk of a future like ours does give us a good reason to think that physician-assisted suicide is importantly different, in cases of terminal illness at least, than other killing. Now, one thing I'll note is the fact that we rule out euthanasia, especially for competent patients who don't want to die. If someone says, I don't want to die, and you're like, well, we're going to kill you anyway because we think it's in your best interest, that would be wrong. So I think that suggests that, Marquis' story, that it's a valuable future like ours, maybe doesn't get at all of it. Maybe the desire to live is part of the wrongness of killing. I don't know what that says about the ethics of abortion, but I think it's worth noting. Anyway. So in light of all this, respect for autonomy, the reasons that we think killing is wrong in other cases where it might be voluntary, all of those are missing with physician-assisted suicide. So, as the Philosopher's Brief says, this full stop prohibition on killing even when the person is terminally ill and wants to die, really the only thing you can reach for to make sense of that is a sort of religious commitment or religious grounds, right? Some religions will talk about this as playing God. The Catholic Church draws on this moral tradition. We haven't really talked about natural law theory. Natural law theory will say that human life is a valuable thing even when the person who possesses that life doesn't value it. So we shouldn't allow physician-assisted suicide. A bit more complex, the Catholic Church's response here than just, it's playing God, and that's wrong. But even so, we're bringing in religious commitments. And we as a society tend to think, and I think this is right, we can't impose our values on other people. We can't limit their choices solely because our religion says that choice is wrong, right? So if the only argument against killing in this case is a religious one, that's not a good reason to make a law or forbid that practice as a society. Another objection that's often brought up here. The role of medical professionals is to heal, to preserve life. Killing is not part of the role of medical professionals. In fact, it is directly contrary to it. Hippocratic Oath, which I'm not sure if doctors still take it or not. I've heard mixed things on this. But at the very least, the Hippocratic Oath is an ideal in medicine, it expressly says, I will prescribe no deadly drug, right? If you give a patient a drug that they're going to use to kill themselves, well, that's definitely giving them a deadly drug, right? What's the response here? Well, I think the response is just to admit, the best one is just to say, allowing physician-assisted suicide will probably change the role of medical professionals in some way. But that in itself doesn't mean that it's bad, right? Change is not always bad. Before doctors would fail to respect patients' choices on the grounds of a concern for their well-being, well, this idea that we have now that doctors have to respect patients' well-being, have to respect patients' autonomy and can't just focus on well-being, well, that's a big change. And likely we think it is a change for the good. So a proponent of physician-assisted suicide would say, well, yeah, if we change it and we say, well, doctors can sometimes administer deadly drugs out of respect for patients' autonomy and their well-being, that is a change in how we conceive of medical professionals. It's a change in the moral code that governs medical professionals. That doesn't necessarily mean it's a bad one, right? And not only does it not mean it's a bad one, but this sort of change might not be at odds with the values of medical ethics, right? We respect autonomy. We also respect well-being, right? Well-being, or what's good for you or what's good for another person, isn't always just more life, right? If it's more life that they judge to be of very low quality, that they say isn't good for them, well, giving them more of that doesn't really seem to contribute to their well-being, right? Okay, so I think these concerns give us a very strong argument for physician-assisted suicide, and it seems they can handle most of the most pressing doubts. Does that mean that physician-assisted suicide should be legalized? Maybe not. We'll talk about that in the next lecture. Aris is, the argument we're going to talk about next time from John Aris, he is very sympathetic to a lot of what the authors of the Philosopher's Brief and a lot of other people who want to legalize physician-assisted suicide say, but he has some misgivings about full-on legalization.